This guided meditation is intended for relaxation and stress reduction. It is not a substitute for medical advice, diagnosis, or treatment. If you have a medical condition, including high blood pressure, please continue to follow your doctor's guidance. Now, allow yourself to simply rest and breathe. Begin by settling into a comfortable position. You may sit upright with your spine gently elongated or lie down if that feels supportive. Allow your hands to rest softly, perhaps one hand over your chest and one over your abdomen. Gently close your eyes. Take a moment to notice where you are, the surface beneath you, the air around you. There is nothing you need to fix. Nothing you need to control. Just arrive. Slowly inhale through your nose and exhale through your mouth. Again, inhale gently, exhale fully. With every breath out, feel yourself becoming more supported, more present, more at ease. Now we begin slow, rhythmic breathing, a proven technique to calm the nervous system. Inhale through your nose for 4 seconds. 1, 2, 3, 4. Pause gently at the top. Exhale slowly through your nose or mouth for 6 seconds. 1, 2, 3, 4, 5, 6. Again, inhale for 4, exhale for 6. This longer exhale signals safety to your body. It tells your heart, you can slow down. It tells your blood vessels, you can soften and open. Continue this rhythm. If thoughts arise, let them pass like clouds, returning again and again to the breath. Now bring awareness to the top of your head. Imagine a warm, soothing sensation gently flowing downward. Relax your scalp, your forehead. Release the space between your eyebrows. Soften your eyes. Let your jaw unclench. Allow your tongue to rest naturally. Your neck releases tension. Your shoulders melt downward, no longer carrying unnecessary weight. With each exhale, your chest softens. Your heart area feels spacious, safe, steady. Your arms relax completely. Upper arms, elbows, forearms, hands. Your abdomen rises and falls naturally with each breath, supporting healthy circulation and calm digestion. Your hips, thighs, knees, calves, and feet relax deeply. Your entire body is now resting in a state of parasympathetic calm. Now bring your awareness to your heart. Imagine your heart beating slowly, rhythmically, effortlessly. With each beat, blood flows smoothly through your body, unrestricted, balanced, calm. Visualize your blood vessels soft, flexible, and open, allowing circulation to move with ease. Each inhale brings nourishment. Each exhale releases pressure. Silently repeat with your breath. My heart is calm. My blood flows easily. My body knows balance. Let these words resonate, not as effort, but as truth. Now we turn toward the emotional layer. High blood pressure is often connected to long-held stress, unexpressed emotions, constant alertness. With each exhale, imagine releasing emotional tension. worry, urgency, fear, control. You are safe in this moment. Your nervous system is recalibrating. Your body is remembering how to rest. Breathing in calm. Breathing out pressure. Nothing is demanded of you right now. Healing happens in stillness. Allow these affirmations to gently land. You may repeat them silently or simply listen. My breathing is slow and steady. My heart rhythm is calm and balanced. My blood pressure is naturally regulating. I allow peace to flow through my body. I release stress from my nervous system. My body responds positively to relaxation. Each breath supports my heart health. Feel these words integrating, not as effort, but as permission. Now allow the breath to return to its natural rhythm. Notice how your body feels now. Perhaps heavier, perhaps lighter, perhaps quieter inside. There is no right sensation. Gently begin to notice the space around you, the surface beneath you, the sounds in the distance. When you are ready, wiggle your fingers, your toes, and slowly open your eyes. Carry this calm with you. You can return to this breathing anytime your body needs balance. Namaste. Keep meditating.